Hi Elizabeth, back with you again. So this is about how pain relates to posture. So few of us realize how related poor posture is to our aches and our pains, and even eventual surgeries. So I'm going to do this as simply as I can. I'm just going to give you three super simple examples, which is kind of hard to do because the body's a unit and everything kind of relates to everything else. But I'm going to just kind of make it black and white just for our purposes here, and talk about three different types of pain and how they may relate to poor posture. So the first one is going to be headaches and neck pain. Okay, and I talked about this in an earlier video. We're going to talk about kyphosis and a forward head. Head weighs about 10 pounds. When we're slumped over, it weighs, in a sense, even more. There's more gravitational force. Okay, so our neck muscles are doing a job that they're not used to doing, and sometimes all day long. Okay, so the head should really float straight above the shoulders, and the shoulders should be floating right above the hip joints. So we would be straight up and down. I can't tell if that's straight up and down. So when we have excessive kyphosis, which is us slumped over, right? The upper back is flexed more than it should be, just about like that, and then our head comes forward. What we've got is a whole lot of neck muscles that are now trying to hold the head up. And they're just stressed and they're just strained, and some of them will contract, okay, like the levator scapula and a lot of these small muscles here, and even the front muscles. They're all going to be in contraction mode if they're trying to carry our heavy head around. And that can lead to tension headaches and various kinds of neck pain. So that is how kyphosis, which is that forward lean of the body, kind of a slump and the head forward, can really affect the neck muscles and also the head. There's this right along here, right along the skull, is where so many muscles are, right along there, and then they're going down into the spine and whatnot. So those are the ones that are really taking the brunt of the situation, which is where tension headaches often show up. So that's just a super quick example. The next one would be low back pain. So I myself had chronic low back pain when I found a GOSQ, and boy, did it clear up. And I'll give you a quickie on that one. So lordosis is this curve. Let me get towards the light. Lordosis is this curve. And if we've got what would be called excessive lordosis, that's extra curve, okay? Especially if we have an anterior tilt. So let's assume I'm looking like that, right? That's excessive lordosis. So there's an extra curve there. Now what happens when that's going on is all these muscles, again, just like the neck muscles, are contracting. So we got quadratus lumborum in there and the erectors. They're all going to be in somewhat of a contracted state and somewhat of a different length tension than would be normal because there's less room in there, basically. So that's what I was dealing with on a day-to-day basis, and I would often wake up in the morning with back pain or even throughout the night because this was tight and contracted and rather tired from overworking all day, and it would just plain hurt. So that all cleared up when I cleared up the tilt that I had. So I had an anterior tilt and a host of other things were going on. It's just amazing what's going on with the pelvis. It's just amazing. But that's just a little teeny bit of lordosis and low back pain. Now let's just go to one more, which is knee pain. I'm sorry if I'm rushing this, and I'm trying to keep it super simple, but I really do want you to understand how getting the body out of its normal vertical horizontal lines. Okay, so if we're rotated, that's in a plane that's out of that frontal plane. That's not where we're supposed to be. We're supposed to be a horizontal line, and then our joints are all vertically loaded, one on top of the other. So when we start to deviate from that ultimate and optimal design, the muscles are all compensating. So they're trying to operate in the wrong position, for lack of a better word, and it creates all kinds of difficulty for the body. And over time, we'll probably start to notice it. So the last one I'm going to talk about is knee pain. All right, so here we are talking about knee pain. Okay, so knee pain and rotation. So if I have a hip rotation is when the low joints are turned. One is forward from the other, okay? So that would be like a right hip rotation, left shoulder rotation. one ankle could be ahead of the other one. Okay, but we're going to talk about a real common situation, which is knee pain related to rotation. So say I've got hip forward. Now there'd be a whole lot of reasons why I would have a hip forward rotation, but let's just say that I do. And what's going to happen is, I mean, you can feel it. I would just really suggest you try this. Take your hips, move them over. Now what happens to me is my knee collapses. So when I'm turning, suddenly these muscles are all having to act a little differently, and this knee's collapsing. So see how the knee comes in. Now our knees are out of alignment. This one is forward and turned in, and we're no longer being, the structure is just highly compromised. The structure around the knee joint is highly compromised. And then if we're walking around, right, I would try that. I would turn your hips, take a little walk forward, and you'll start to notice that you'll recruit all kinds of muscles that aren't really meant to walk you forward. They've got other jobs. But the main point is I want to tell you is that knee joint is compromised. Once the joints aren't on top of each other directly, okay, they're curved, they're turning, they're at an angle, it's just compromising the whole knee. So eventually something's going to wear out in there. I mean, that's just basically the truth. So that could be from just hip rotation. Hip rotation all day long could cause knee pain. That's just one example of why that is. And if you want to see it from the front, this knee has come forward. Now, if anything out of the gravity line, left or right, is a compensation that's gonna disallow the body to really function as it's meant to. So that's just a real quick, super oversimplified connection between pain and posture. I sure hope that made sense.